So CPAP by definition is continuous positive airway pressure, but that's just one of the things we use in treating sleep apnea. There's also BiPAP and something called ASV or auto-servo ventilation. So there's multiple things that can be used to treat sleep apnea. CPAP is a pressure that keeps the airway open and allows the patient to breathe normally from the airway getting smaller, or there's adipose tissue inside the airway, also just allowing the patient to ventilate.
Derick says men are 45 times more likely to have sleep apnea than women. However, that shouldn't prevent female patients from seeking further treatment.
So the home sleep study, which I can demonstrate here in a little bit, is the ability to do a sleep study at home. There are some differences between an in-lab sleep study and a home sleep study. When you do a home sleep study, you're doing it in your home environment. So you've got that comfort level of sleeping in your own bed and your own environment. So a lot of people are able to sleep better. When you do it in lab, there's a lot more things that can be done as far as treatment for sleep apnea.
Brookings Health System has home-like sleep study rooms so patients feel more comfortable while undergoing sleep apnea tests.
Through the pulse oximeter, the PTAF, or pressure transducer airflow nasal cannula thing, thermocouple, how much you're moving around, what position you are, your effort of breathing, we can create a picture of if you have sleep apnea or if you don't. Mild sleep apnea is if you have anywhere between 5 and 15 events per hour. Moderate sleep apnea is if you have between 15 and 30. That's every hour, and anything over 30 is considered severe. So if you think 30 respiratory events per hour, that's every 2 minutes you're kind of waking up. You might not be fully awake, but just imagine if tonight when you were sleeping, if somebody was waking you up every 2 minutes, by the morning you're going to be tired, you're going to be exhausted, you might have a headache, you might have a dry mouth from breathing through your mouth.